So it'd be right about here on the insulin pen. And then we are going to take the cap off of the insulin pen, and we are going to observe if it's clear or cloudy through this area here. If it's a cloudy insulin, we're going to gently roll the pen between your palms 10 times. And then we are going to invert 10 times to properly mix the insulin. Next, we're going to take an alcohol swab, and we are going to scrub the hub for 15 seconds. Without touching the area that you just cleaned, we are going to take the cap off of the needle, insulin needle. So this is the insulin needle. We're going to take the cap off. And do not touch the inside of the cap because it is sterile. And then we're going to insert the cap onto the needle of the insulin pen until you meet resistance. Okay, to prime the needle, turn the dial to 2 units of insulin, and then press the plunger down to release the insulin. You'll actually, at the end of this, see drops of insulin in your cap. We're going to leave this on until you actually administer it, but you'll be able to see the drops through the cap. If you don't see these drops, you can repeat these steps where you turn it to 2 units of insulin and press the plunger down 6 times. If nothing happens, then you have to call pharmacy for a new insulin pen due to malfunction. For administration of the insulin, perform proper hand hygiene. And then place clean gloves onto your hands. Prep the patient's skin with an alcohol swab in a circular motion for 15 seconds. Allow the area of the skin to dry properly. Be sure that you have verified the healthcare provider's order, the insulin, and the patient's name and date of birth. By looking at the order, we know that the patient will be receiving 6 units of insulin. So we're going to dial the insulin pen to 6 units, just like that. Verify the dose of insulin with the order. Once everything's been double checked with the dose, the order, and your patient was verified, the area of the skin should be dry. You're going to stabilize this, take the cap off. You're going to stabilize the skin with your hands. You're going to compress the needle into the skin, and then you are going to compress the plunger to administer the 6 units of insulin. Hold this position for 10 seconds to ensure that all of the medication has been introduced into the subcutaneous tissue, and then release the pen from the patient. Once you release this pen, the needle automatically contracts into the needle portion here, and then you're going to put just the needle portion, this is very important, just the needle portion into the sharps container. You keep the actual insulin pen. Once the needle is discarded, place the cap back on the pen and replace the insulin back in the medication drawer and perform proper hand hygiene.